I would want to say Bungoma is among the most populous counties in the country, and currently our projected population stands at over 1.9 million, and our fertility rate is slightly high. We are at 4.7%. That means on average the women in Bungoma give birth to 5 children.
My area of work mainly is about the reproductive health. Reproductive health for the women, reproductive health for the child, for the youth, the adolescent. The women, we have some key areas, that is from the antenatal care services that we have to give to our women. Number 2, after antenatal care, we come to the postnatal care services for the women that receives. The next thing is about now skilled deliveries. So that is the priority areas that we have to make sure all pregnant women, 100% they have to deliver in our facilities.
Our skilled delivery in Wombia West Sub-County are at 84%. So we still have a gap. There's some mothers delivering at home. And for postnatal services, we are very low. A mother will be deliver. She will deliver from maybe our hostel, mother hostel Webuye. Then she will go home after 48 hours. So the woman will not come again for the service until she comes at 6 weeks for the baby to get immunization.
The RMNCAH Scorecard is a very crucial tool for us as a department. It entails various indicators which we monitor in terms of RMNCAH.
A scorecard is like a report. The report card gives both figures and also figures in terms of percentages, and also it is color coded. The green color will show that you have achieved the required coverage in terms of percentage. Then we have the yellow color that shows that you may be on course, but you have not achieved. You need to put in more efforts. Then we have a red color that I want to be very polite and use the word areas you need to put in a lot of effort, that you are not achieving the required goal.
The RMNCAH Scorecard in Kapchai Sub-County, we are using it during the maternal perinatal death review audits. So as we do the maternal audit or the perinatal audit, death audit, so we find the gaps that were there, that if these particular gaps could not have been there, we would in one way have saved either this neonate or this mother.
As a Kimilili, we were doing below 50 on skills deliveries before the scorecard came in. But after now introducing the scorecard, we are doing very well. And even as a county, we are doing almost 82% on skill deliveries, surpassing the national one, which is I think at 72 or 74.
The RMNCAH Scorecard actually has a lot of indicators there, but looking at immunization, it looks at the antigens and how we are giving. And then the good thing about the RMNCAH Scorecard is when you look at it at a glance, with the colors, you can easily tell how you are doing. So at a glance, when you look at your scorecard and you have produced it and you see so many reds, you already know there is a problem. After you've noticed there is a problem, you'll want now to go inside facility by facility and see where the problem is. One facility could be having staff issues, another one logistics, another one even just timing. We went down to the facilities and picked on the issues. So interventions is like proper forecasting to make sure we don't have stockouts of vaccines, syringes, and all that is needed for immunization. So we did forecasting, one, facility forecasting and then sub-county forecasting, so that as we order, we just order enough for that. On staffing issues, we have organized ourselves in such a way that even where there is one staff, if that staff is not there, we get somebody else to work so that children do not miss vaccination. It is, you compare last year and this year, now we have done 2 quarters. We are actually on the upward trend, and that is why we say the scorecard is good, because that was our beginning. We looked at it and we saw we are not doing well, and we said, then we have reviewed and seen at least we are going up. So we are going to maintain that and add more strategies so that we move upwards.
One of the gaps was the issue of referral. For you to refer this patient to reach the facility where she's supposed to be done on operation, you are supposed to do it promptly, on time, so that you save both the mother and the baby. But there are times we could lose either the baby due to challenges in terms of referral services, the ambulances, as well as fuel. So from there, we came up with a strategy. Usually there is some allocation, financial allocations that are given to the facilities. There's like a small percentage which asks each facility to put aside some money for fuel. So whenever you could have a referral, you call, you need an ambulance, then they could give you an ambulance. They later on decentralized the ambulances. They made sure that every sub-county has got at least two ambulances.
Apart from the scorecard being used as a tool to track progress or deviations from the norm, it's also a tool that can be used as an advocacy tool when you meeting the policy makers. You find those people mostly they don't really want to see data, numbers and figures. But if you come with charts and they're like posted and painted, you have told your ward is like in red. They're like, hey, my word is in red, why? Then they get that impetus to ask. So you'll be able to explain further and be able to unpack what is it in it that you want them to get from that particular color that is painting their word.
Among the people who are losing life as a result of loss of blood were pregnant mothers. Out of 5 pregnant mothers who were dying, 2 were dying as a result of postpartum hemorrhage. A major cause that was affecting that, it's the lack of a blood donor center in Bungoma County. Therefore, there's a lot of delay as blood needs to be gotten from the regional blood donor center in Uasin Gishu. That's quite some distance. Therefore, members of the CSOs, including RMNCAH network, led the budget advocacy interventions to the county assembly to advocate for Bungoma County to have a blood donor center of its own. A budget of 30 million was allocated and groundbreaking was done. In financial year 2020-2021, again 10 million was allocated to continue with the project.
A mother coming to deliver at a facility, normally utakuta nyumbani wanaweka kuku mahali wanafunikia ama kambuzi. They're expecting a mother to come jioni ama kesho yake na mtoto, so they are like preparing for a celebration. They know a new member of the family is coming, and this is not a sickness, it's not an illness, it's just a process. Anakuja kujifungua na ende. So why is it that they should come and die within our hands? So it's an undesired event or consequence. We desire all mothers to have a safe delivery, whether it's by cesarean section or by normal just SVD deliveries, and then of course be able to go home with a bundle of joy. But in the undecided event that a death has occurred, then what is it that made the death occur? If the death occurred out of things that are humanly preventable, then let's prevent them from occurring the next time we meet another mother who needs similar services.
I would very strongly recommend that as many managers as possible be able to access, understand, and use the scorecard. It will make life very easy in terms of decision making.